Hi, today we're going to use the mirror box. The mirror box is used to treat different symptoms including patients with pain and stroke. The purpose of the mirror box is to retrain the brain by tricking it to make believe that the affected arm is moving in a pain-free range. This can be done by looking at the reflection of your unaffected arm and imagining that your affected arm is actually moving. This can be done with most body parts. For this video, we're going to use the hands as an example. To begin, we're going to start by making the hands look as similar as possible. This means taking off jewelry, watches, and covering up tattoos. For our program today, we're going to use a graded program that will attempt to reduce your pain. First, we'll start to use movements that involve little or no movements in your effective hand, and then we'll increase force and perform more difficult movements. To start, you put your effective arm, or in this case your left arm, in a box, and put the right hand outside of the box. Place the hands so that they are in the same position and try to envision the reflection as your left hand. Next, while keeping your left hand still, move your right hand and rotate it back and forth. While doing this, imagine your left hand's actually doing the movement, but don't actually do it. After doing this a few times, go ahead and leave your left hand still, but with your right hand, touch your fingers with your thumb. Again, imagine your left hand doing this motion without actually performing it. Okay, now with your left hand, curl it slightly so that your fingers are bent in a little bit. And with your right hand, go ahead and make a fist. As you do this, envision your left hand doing the same thing as your right hand. After we have done those steps, let's progress by doing different movements with the left hand. With your right hand, I want you to bend your wrist up and down in its full range of motion. With your left hand, I want to bend it in the limit of pain. So this should feel a little uncomfortable, but you should not have pain. And I want you to mimic the same pattern. Alright, the next movement, we did this earlier, but with your left hand, you're actually going to do the movements now. So touch each finger with your thumb. But with your right hand, I want you to do it with more force than your left hand. And again, this should not cause any pain, maybe a little discomfort. To progress, we're going to choose a familiar activity such as writing or squeezing a ball. So in this example, I'll use a pen. So with your right hand, I want you to pretend that you're writing, and your left hand mimic that same pattern. Finally, to progress even further, choose a more threatening item or an activity that is more dangerous than the previous activity. In this case, we'll use a knife as an example. So in this example, we'll pretend that we'll be cutting something. And with your left hand, I want you to do the same motion as your right hand. The goal of these activities is to reteach your brain to learn these motions and not associate with pain. So eventually we would like to perform these activities and mimic the hands without the